funny how things work, but sometimes we do a lot of procedures that are the same in a row. Usually things are mixed up. So one day it's breast augmentation, next day it's tummy tuck, next day it's a facelift, neck lift, it's eyelid surgery, it's a lateral subcutaneous brow lift, it's lipo from head to toe, this, that, and the other thing. Or sometimes, ahead of a weekend, we might not do bigger procedures and just have a day where it's all day long injectables, Restylane fillers and Dysport neuromodulator, Botox, etc. Today is our 4th day in a row in the morning of doing fat transfer to the face. So in order to do fat transfer, and we'll describe why in a minute, we also have to first find fat. And we have some patients who are slim, such as our patient this morning, who's actually in the healthcare field, right?
Yes, sir.
Yep. And so sometimes it's hard to find fat. Our patient doesn't have a lot of fat, but we need some living fat, her own fat, in order to do some volume restoration, reshaping of her face in order to give her contours, not like somebody else, but more like she was 15 years ago, 20 years ago, 25 years ago. So it's always the project helping people look naturally younger and like themselves, not weird and like somebody else. So we did fetch some fat, and I spun the fat down in the centrifuge, and it kind of looks like some sort of a dessert like this. You can see this stuff on the top, which is a little bit jiggly, and it looks kind of liquidy. Sometimes doctors do blood tests for you to check on your triglycerides floating around in your bloodstream. Those are triglycerides. Not only do you not need very many of those floating around in your bloodstream, at least within normal levels, they should be, but we also don't want a lot of those in our transferred fat. So I just decant those. And then this is the below part, we call it the infranatant. This fat is the supranatant. And so I hope you just saw what I did with that. I got rid of that. And so now we're left with just beautiful golden fat, which along with its friend syringes here, I will use to rebuild the face. I use tiny little tools. This is one of the tiny little tools. Sometimes I use ones that are even skinnier than this and that I can bend and creep around corners. If I need one also tiny, but a tiny bit longer, then I might use that one. Those are my two workhorses. That's known as a 0.7 and that's a 0.9. This is a 1.2. Sometimes I use it, not so often. But with this little tool and making a little needle poke in the skin after I numb things up, which I haven't done yet, then I can poke through here and, for example, I can lay fat down on the bone that is in the upper part of the eyelid here. And this area towards the center, the medial part, loves to get deflated. You can kind of appreciate that the eyelid here is full and the eyelid here is sort of depressed and dented in. No big deal, you might think. However, this whole area around the eye especially does deflate over time, and the area around the eye is much like a picture frame. And so in the beginning of time, the picture frame is sort of thinner, and then with time, this frame starts widening out and getting dented in. So if you look at eyes when they're young, you'll notice that there's not too much of an area where we could draw a circle around the eye. And then as eyes get older, you'll find that we can draw a bigger and bigger circle. Right now, if you look at the area of depression, which is here, starting about here, all the way up to, let's say, here, that's a big circle to draw. And we'd like to tighten that up, in other words, raise that up. So I'm going to go through here in a minute, and I'm going to lay fat down on the bone right underneath the orbicularis oculi muscle, what's called the septum up here on the top. And I'm going to lay little pearls of fat all along here and help build this up and build this up. And it's going to be making the frame around the painting, which is the eyeball itself. It's going to make that frame nicer, neater, crisper, and younger looking. That is just a very quick description, simple description of one area and part of what we're going to do with that. Also, this area right here on the outside of the eye, the lateral commissure area here does deflate. Needs about 1/4 of a syringe of fat right in here, which I can get to from this little poke hole right here. The temporal areas, the temple areas, they hollow out with time. So these always need something like 1 syringe, syringe and a half, 2 syringes, 2.5, you know, depends on the person. It's all different. Again, through that little poke hole in a minute, I'm going to be able to lay down all these nice little pearls and channels of living fat there. And I'm going to continue throughout the face, working on all of the areas that need some contour. I think you can probably appreciate this area here is a little bit deflated. And then people complain of their jowl. So if this is deflated, you know, you might be tempted to say, well, look, this is a jowl here. Okay, we can call it that, but actually if you look, this is very thin. There's not a lot of fat in there. The jowl is an interesting area. It does like to retain fat more so than the neighboring areas, that being in front of the jowl and behind the jowl, and as such, it can look bigger. More of an issue is the fact that it has retained its fat and the surrounding areas have lost their fat more quickly. So as we build the area up, let's say from here to here, that being the pre-jowl notch and in front of the jowling and from the corner of the mouth out to the jowling, and then in the nasolabial fold, all this will kind of get lifted, blended in, and shaped. It's all what it's about. It's not just about filling, it's about shaping. It's all about contours. And they're not simple, actually. They're very complicated. And so one should be a student of contours and how faces look when they're young and how faces look when they're middle-aged and how faces look when they're older. And then we should work to craft back that which has been lost over time. Sounds easy, right? Stay tuned. Dr. Richard Buckley here, MilfordMD, and thank you for watching. Richard Buckley here. Remember, this morning's project is autologous fat transfer, that is to say fat grafting to the face with living fat cells that we harvested from our patient's inner knees in this case. Inner knees are nice, lower abdomen is nice, and really you can get it from the arms or so many places on the body. And I showed you the syringes. We have a number of them that we've spun down. We centrifuge the fat, get the fluid out, concentrate it. And I fill these tiny little 1 cc syringes, like so. What did we do yesterday? Did you count 80? Yeah, we put 80 of these in a woman's face yesterday to rebalance that. We're not going to do that many today. We have a younger patient today. I made a little poke hole here after numbing it. The patient's reasonably comfortable, yes?
Yes.
Yeah, it's not that everything is numb. It's just where we're working is numb. But these living fat cells, I'm going to lay down in this area that we call the marionette line area. Typically comes off the corner of the mouth and goes down here, and there's a fold much like a continuation of the smile line up here, the nasolabial fold, and it continues down as a marionette line, and then there's a dip in front of the jowls called the pre-jowl notch. And so I'm going to work on laying living fat down in those areas. Living fat means it's going to live. How long is it going to live? Whatever percentage of the fat cells we put in there that get themselves established are going to live there permanently. You know how fat is. If it's someplace you don't want it, it just sort of stays there permanently. So absent any change, then it's going to just stay there permanently, which, since it's in a place we want it here, that's a very good thing. Thank you for watching MilfordMD, autologous fat transfer, reshaping of the face to more youthful contours.